All right. We on?
Yes, we are.
Great. All right, let's get started. Today we're having a discussion, a briefing on nutrition assistance programs. We've obviously had a little bumpy road earlier this fall with SNAP and the federal government. And with us to begin from the Department of Human Services, we have Webster Yee, one of my favorites, as Chief of Staff from the department, and Larry Handerhan.
Yep.
Who's the Assistant Secretary for Programs. I see we have packets on our table, which I assume you're going to be using.
Yes, sir.
All right, well, take it away.
Thank you. Good afternoon, Chairman Gazone, Vice Chair Rosapet, members of the committee. Like I said, I am Webster Yee. I serve as the Chief of Staff for the Maryland Department of Human Services. With me is my colleague, Larry Handerhan, our Assistant Secretary for Programs. Mr. Handerhan comes to us after distinguished service with the federal government and also with the D.C. Department of Human Services. And he spent his entire time in the child welfare and economic assistance side of the world. So he very much knows his area. He came on board last fall, and we gave him two very fun homework assignments. The first one is the one most germane to this committee, which was implement H.R. 1, our term for the one big, beautiful, whatever bill that occurred last July, became law on July 4th. Implementation largely started or kicked off on November 1st of last year. And I'm going to ask the committee to consider three data points as I go through the background slide. The first is, in any given year, Maryland's Supplemental Nutrition Assistance Program, SNAP, or formerly known as food stamps, serves about 680,000 Marylanders. In one of the next slides, we've got it broken down by jurisdiction and by region. The second key number to raise is, out of that 680,000 set of customers, over 260,000 of them are children. They're under 18, they can't work, they go to school. The third item is we issue approximately $1.6 billion, but out of that $1.6 billion in federally funded benefits prior to H.R. 1's passage, the average monthly benefit is about $180 per month per person. This is not a large amount of money. One grocery run will probably take care of $180 pretty fast.
Just that you weave into whatever you're going to talk about. With that many children who are receiving SNAP benefits, so each one of those are getting roughly $180,000 in addition to who else in the family may also be. Can you weave in what we know, and this is a bill that I've been dealing with for a number of years, on school meals, and what we know and how, if that is a consideration, or how we should think about that in the context of both of those programs.
Yes, sir. And actually, Mr. Chairman, one of the most important data points that we've gotten over the past 2 years was, with the committee's assistance, your leadership, sir, the General Assembly enacted the latest version of summer EBT, Sunbucks. And so the 260,000 children you see here that are SNAP customers, that number, that additional number, when combined with children in the free or reduced lunch program, added up to over 600,000 school-age kids. And so that's an enormous chunk of the population. And just want to keep, have that number in mind. As you look at this county by county breakdown, we've got it broken down by adults and kids. And as you can see, kids are a massive chunk of this population. As the chairman noted, earlier in the year, late last year, we went through the longest federal shutdown in U.S. history. And it had a massive impact on our customers. Beginning October 1st, we were able to fund October SNAP benefits using carried over federal fiscal year 25 funds. Once we ran out of those funds for November issued benefits, with a lot of very conflicting and, we would argue, outright cruel guidance from the United States Department of Agriculture, we were not able to issue benefits for a few days. And one of the key items here is the governor declared a state of emergency. He took a large number of actions. The two most important items with respect to SNAP customers was first, we announced a $10 million emergency grant to support Maryland's food banks and nearly 100 community food pantries. Ms. Wallenstadt, I believe, is presenting for the Maryland Food Bank a little bit later in the presentation. We worked hand in hand with the Capital Area Food Bank and the Maryland Food Bank to get that $10 million out as soon as possible. And we really support and applaud their partnership in getting that vitally needed food, not only to SNAP customers, but to federal employees that were also impacted. The second action that the governor took was to make $62 million available to make SNAP customers whole following a federal judge's order that the federal government had to provide contingency funding for SNAP. Of that $62 million in state taxpayer funds, we used about $2.4 million of that to make folks whole before the federal shutdown ended, and we restored federal benefits by November 18th. In the federal shutdown continuing resolution that was passed, there is a provision that requires that the federal government reimburse the state for state funds used during that period to reimburse and make folks whole. We're currently going through that process right now to get that money back. And then with that, I'm going to turn it, hopefully sooner than later, Mr. Chairman, and I'll turn it over to Larry to
So
go
they've
through.
given you no indication?
They have not, sir. They've actually been completely radio silent.
Great.
So I'm going to pivot to the impacts of H.R. 1, the One Big Beautiful Bill Act that we've referenced so far, and how it impacts both SNAP customers, and then start the conversation about taxpayers in Maryland. I'm going to cover eligibility obstacles, eligibility restrictions, and reduced benefit values, which are the three kind of buckets of changes that we're tracking on the customer side. Next slide. I think it's really important to note that at the same time, all the chaos, quite frankly, that we were talking about in November with the SNAP program was happening due to the shutdown, the changes to H.R. 1 were also being implemented at the same time. This went a little bit under the radar. So we're starting with this slide, which is the changes that are in effect today in the SNAP program in Maryland and across the country. There are three in big buckets. One is the expanded work requirements. I'll talk about all of these in much more detail. Two, most refugees and asylees are not eligible for SNAP any longer unless they also have they're also lawful permanent residents, which means they have their green card. And then third, households, this should say, without an elderly or disabled member, we'll get that corrected for the dissemination afterwards, are no longer automatically eligible for what we call the standard utility allowance. And I'll talk a little bit about that in a moment. So implementation started in November for us, but because most SNAP redeterminations happen at a 6-month period, we're getting information in real time and on a rolling basis. I'm going to talk about how difficult it is to implement changes like this on the SNAP side and give a little bit of an indication that SNAP is the kind of tip of the spear of H.R. 1. The Medicaid changes are just as dramatic, if not more dramatic. Those don't hit till later. So right now, this is what our customers are facing. Please.
Quick question. On the ones affecting immigrants, do we have any sense of how many immigrants are affected by the changes? What percentage? I don't know, the number of immigrants who go off the rolls because of the new law?
Mr. Vice Chair, we're getting that data right now. We do not have the exact information, and the reason is we got federal guidance. We've been getting federal guidance on an ever-changing basis every couple of weeks, it feels like. And the technology changes went into effect on January 23rd. So now we've got, prior to this, it was you were ineligible due to basically immigration. Now we've got the specific reasons that we're tracking that.
Yeah, if you could just get that to us when you have it, I'd appreciate it. Thank you.
I should also say I think there's two ways to answer that question. There's the kind of direct impact of people who will no longer be eligible because of the law, and then those impacted by the chilling effect, who are no longer applying for benefits and who are no longer even attempting to get benefits, even if they, let's say, have their green card. So on the work requirement piece, this is, again, it is difficult to exactly assess how many people might be impacted by these provisions. We have projected up to 80,000 additional Marylanders who are going to have to jump through hoops if they want to maintain access to SNAP and maybe lose access altogether. The three categories are up on the screen. Those are adults aged 55 to 64. Previously, that population was not subject to work requirements. The second category I think about as parents of teenagers. So if you're an adult 18 to 64 and you don't have a child younger than 14, you need to be working or meeting the work requirements. That used to be 18. So I think that's a group of people who are going to be really important for us to reach. And then we had a series of categorical folks who were not subject to work requirements but are now veterans, individuals experiencing homelessness, and former foster youth up to the age of 24 who aged out of care. We put this slide together explicitly to show the before and after. As a bit of a side note, the SNAP law has a term called able-bodied adults without dependents. It's called ABODs. The idea was if you didn't have a child in your home and you weren't disabled or elderly, you should be working. This law functionally really changes who that group, what that meaning is and who those people are in Maryland and across the country. So you can see the kind of comparison of before and after in the slides. One thing that's very important I want to make sure we're clear on is that people who are disabled in a drug or alcohol treatment program or who are mentally or physically unfit for employment are exempted. So they will not have to meet the work requirements, which I'll talk about in a moment. The definition of unfit for work is not spelled out in the law.
But if you're homeless,
Yeah.
you're required to be at work.
Yep.
That
Yep.
should be interesting for the homeless.
Yep. It is, it's hard to wrap your head around. All right, so what are these work requirements? SNAP, unlike Medicaid, has had work requirements in the past, so I will say that DHS is equipped to implement this, even though we do not agree with the condition. So if you are subject to work requirements, which again is many more Marylanders than before this law passed, you must be working, volunteering, or in an employment and training program for 20 hours a week. In most cases, education does not count, unlike in Medicaid, where education would count as an exemption. There are, of course, it's never that simple, and sometimes I think the complexity is a feature, not a bug, of this law. But because of definitions of work and the high minimum wage in Maryland, you could be working 14.5 hours equivalent at minimum wage to meet the requirement. That means that we would certify that you are doing that, and you would be able to maintain your SNAP benefits as long as you, every time you come for a redetermination, you can prove that you are working. Something that is important and again often missed in this conversation is that if you are subject to these work requirements but not meeting them, you can still receive SNAP, but only for 3 months in a 36-month period. So right now, we're not seeing a lot of people lose benefits. That will start to change in March. As we talked about, refugees and people granted asylum are no longer eligible for SNAP. This will, for current recipients, they will present for the redetermination and be told this. The good news is that if any of those individuals become lawful permanent residents, if they get their green card, they will be able to receive SNAP benefits again. There was some confusion about the mechanics of that, so we've tried to spell out a lot of specifics in this slide that I don't think are necessarily worth going through at this moment. But again, the complexity here and the chilling effect that we see more broadly is a real challenge for us, and I know that a lot of you care about this as well. And then finally, this is the standard utility allowance that I mentioned earlier. So a feature of this law is not just saying who is eligible for certain restrictions. There is a lot of administrative red tape for both staff and for our customers. On the customer side, we used to have a deduction that was just a standard amount of money you could deduct for your utilities, which meant that you got a larger SNAP benefit. If you have an elderly or disabled member of your household, that doesn't change. You still will get the larger benefit kind of automatically as a deduction, just like in your taxes. If you don't have an elderly or disabled resident, you will have to provide your utility bills, which is something you probably you've never had to do before, in order to get the deduction because of HR 1. So this is going to affect thousands of Marylanders. And again, just so much work for those customers and for our staff. We'll talk a little bit later about how we're trying to address that burden. I'm going to pivot to the increased cost to Marylanders before turning it back to my colleague. The most immediate fiscal impact to the state is that the administrative cost share for the SNAP program is moving from 50-50 to 75-25. So this used to be equally shared between the federal government and the state, and now the state is responsible for 75% of the administration of the program. We spend about $115 million in general funds to administer SNAP historically. That will need to jump by $43 million in state fiscal year 27 because of the prorated nature of when the federal fiscal year starts. And again, this is just to cover activities that are already happening as the shift from responsibility at the federal level to the state level changes. This is dramatic philosophically. And I think in some, combined with what we're going to talk about next, is a real sea change in how public benefits are administered in this country.
So before H.R. 1, and again, this is a set of conversations that we're going to have with Senator McCray and the members of the Health and Human Services Subcommittee. I think between us and Health, we've got 16 budget hearings, and this is going to be an item of continuing conversation. But prior to, only 16, sir, I think. Look, we'll do whatever distinguished committee counsel tells us to do. If he wants to collapse it down to one, happy to. As my colleague, as Larry mentioned previously, 100% of benefits were previously federally funded. As of October 1st, 2027, we're expecting that Maryland could be responsible for 15% of that $1.6 billion in total cost, or 15% of those benefit costs at a cost of approximately $240 million. And that's based on H.R. 1 had a mechanism that said if a state has a certain payment error rate, which I'm going to go into in great detail momentarily, over 10%, then it's a 15% state match. Let me state from the very get-go that our job as the Maryland Department of Human Services, and as we've briefed members of the General Assembly in previous briefings throughout 2025 has been, and in years before, is how do we reduce the payment error rate as close to zero as possible? And so let me talk about the SNAP payment error rate. It's a measure of how states determine eligibility and benefit amounts by checking the number of under or overpayments. This is not customer fraud. The SNAP payment error rate is not a measure of state fraud, waste, or abuse, and it's not a question of whether a customer filed or said something incorrectly or not. It's a quality control check on what the state has done administratively. And what does that mean? I'll go to in great detail again, just to give you a visual illustration of what I mean by we've been trying to get it to zero as quickly as possible. Starting in January 2023 to September of 2023, we had about 9 months to reduce the error rate. When we came in, the federal fiscal year 22 number was the second highest in the country, behind only Alaska. By federal fiscal year 23, it was dropped down to about 18%, and then for federal fiscal year 24, it's down to about 13.6%. To give you an example of when did these numbers come out, federal fiscal year 25 ended on September 30th, 2025. The federal government is expected to release the latest statistics for federal fiscal year 25 in June. And so we are forever 6 to 9 months in course correcting, making changes, and any changes that we have done will show up 6 months to 18 months later as the feds update their numbers. For comparison's sake, we put Maryland up against similar states and neighboring states. And as you can see, we're more or less in the same pack. And you might ask, well, okay, what about states that are like South Dakota with a 3% payment error rate? South Dakota is a much smaller state than Maryland. They also have very simple, if you will, SNAP eligibility guidelines. It's simple because they're trying to reduce the number of people that they serve. It's pretty simple there. It's when you're trying to ensure that complex calculations are done and done right, that you get a higher error rate. I talked about this briefly, but the main point and the main factors that we've addressed and that I'll go into detail are you reduce the payment error rate by ensuring that we have state employees, ensuring that the state employees are trained, and that they stay after they've been trained for a longer period of time. In addition, we've addressed the technology side. And then the third part is changes in federal primarily and sometimes state policy. And those are, the more changes in policy you have, like with HR 1, the greater complexity and the greater confusion you'll have with the staff side making things work. What does the 13.64% payment error rate break down to? It's a statistical sample that's derived from the information in front of you. I'm not a mathematician or statistician, but as you can see, it's a relatively small number of cases, about 1,100 cases, and the total overpayment number was 91. The average error amount was $246. That's layered against our average monthly payment per SNAP customer benefit that I said at the beginning of $180. Our total underpayment value, as you can see, the statistical sample is 55. The average error amount was $205. This is not a great deal of money. When statistically extrapolated, you get to 13%. Yes, sir.
I don't understand this. So who is doing the measuring?
The United States Department of Agriculture, the federal government.
Okay, they go into our database and take a sample out?
Yes, we work with them in providing, the samples. They're the ones who make the final determination on the math.
And I don't see it here. I may have missed it. But I'm not asking what causes the error in the sense of somebody made a mistake. That's obviously what caused the error. But what are the errors exactly? That's what I don't quite understand.
Sure. Well, one of the simplest ones is if I send in an application and I leave it incomplete and there is no follow-up, that's an error. If I send in an application and it's not fully complete, and the Maryland Department of Human Services issues a benefit, say to one member out of 4 that might be eligible in a household, that also is an error. If all 4 members come in later and we fix things, or they produce whatever paperwork, we fix the error, but it still counts as an error.
So that example is basically recipients not providing the adequate information.
That is actually one of the original highest factors, the number of incomplete applications, sir.
What would number 2 be?
The second part is applying the correct policy when you're evaluating an application. And so we'll get into this in terms of the things that we did to fix things. But for example, if I'm a caseworker and Senator Augustine sends an application and we are applying Senator Rosa Pep's law that was just passed, or HR 1 that was just passed, to Senator Augustine's application, if we applied an incorrect provision, say HR 1, pre-HR 1 stuff, then that counts as an error.
Okay, so that's an error not by the recipient, but by the department.
Yes, sir. And again, these are not recipient fraud or errors. It's a administrative calculation.
No, I get that part.
Agency
What would
did.
be number 3?
I would say, Mr. Vice Chair, that it's technology. It's a question of prior to this administration, they switched to a new system called enrollment and eligibility on the MD Think platform. When it was first switched, there were a number of technology issues. We spent the past 3.5 years fixing things.
Okay, so that again is an agency issue, not a recipient issue.
Yes, sir.
So the big 3 would be 1 is recipient and 2 are agency. Is that the way to think about it?
No, sir. They're all agency.
Well, no, the recipient, if they're not providing the information, that's on the recipient.
But the burden is on the agency to get in
To go back
contact with.
and get the information. Okay,
Yep.
all right. Okay, thank you, Mr. Chairman.
Could I add one point too, that you see this, you hear people talk about this as change drives errors. So it's a change in a household, you get a new member, your job situation changes, your income changes, that's where mistakes get made. And policy changes. So policy changes at the state, but also policy changes at the federal level. And I think the standard utility allowance changes in HR 1, for example, that will lead to errors because that's what we see whenever policy changes, errors around that goes up because you need to.
And one of the key points is training and vacancies. When we first started in 2023, DHS had a vacancy rate of over 19% in April 2022. We've since brought that down to around 4%. Agency-wide, we're at about 7%, a little bit over 7%. We have taken advantage of every opportunity to continuously hire. to train our people and to try to keep them as long as possible, because it takes time to train a caseworker. It takes continual training to ensure that they're up to date on how to apply changes in policy that Larry mentioned to an applicant's application, and it takes time to ensure that we are consistent statewide. One of the areas that we noticed was across the various local jurisdictions, there wasn't consistent training on how to review things. When I first started, I went to a local office in Senator Stallings' district. It was a bunch of folks who had never done this before. They were in a large, dark room. It was overheated. And they had a death by PowerPoint training session with over 100 slides. It didn't work. Let's just be really clear. Now we've got training that's more streamlined. It's more designed for humans. And instead of just saying, okay, we're going to give you 30 plus slides of PowerPoint, we also give them the technology tools of, hey, here's the new policy book. You can ask AI to help you understand, okay, Larry has this application. If I put in the variables, how does that compute with the latest changes in policy? And with that, AI-powered training, that's what we're doing. We're also trying to automate as much as possible certain select functions to free up staff time, because the most important part is we're not using AI to make the determination. We're trying to train our humans, our staff, to say, okay, if I'm looking at Larry's application, does this make sense? Is the computer spitting out something that isn't nonsensical? And this is an extremely detailed PowerPoint. If you want to talk about it, we're happy to talk about it offline. But this shows the work that we're doing on the technology side over the next 12 months for things that are addressing collectively the SNAP payment error rate. This is an example of the roadmap that we've done in years past, in 23 and 24, to reduce our SNAP payment error rate. Yes, sir.
Has DoIT been playing a role in all this with you?
Yes, sir, very intimately so. The three secretaries, the Health, the Human Services Secretary, and Secretary Savage of DoIT, have been meeting at least once a week, if not on a near daily basis, to follow through on what are the technology changes, what are the supports needed, how do we ensure previously MD Think, now Maryland Benefits, are focused on making things work.
How many so-called tech people did you have yourself? How many from DoIT have come in to work with you beyond the folks at the high level?
I don't know the exact answer, Mr. Chairman. I'll get back to you. There was a transition at the beginning of state fiscal year 26 where the administrative control for Maryland Benefits was shifted from the Department of Human Services to DoIT. And DoIT now has assumed the overall platform for Maryland Benefits. And then the enrollment and eligibility system, which does both SNAP and Medicaid, is run now through DoIT. Previously, it was run through MD Think, which DHS was administratively in charge of. And we'll follow up again on the exact numbers.
I'd be very interested in all of that.
In addition, we are also addressing changes in federal policy. We're working with the National Governors Association and also the United States Department of Agriculture on national level things that could be done better. So for example, one of the new initiatives that is occurring on a national level is the National Accuracy Clearinghouse, and it's to help data comparison to basically keep folks, if there's a change in residency, to have that residency change reflected more quickly. We're also working with partners such as Georgetown University, Philanthropy, Code for America. We just signed an agreement with the U.S. Digital Response Service to help us with leveraging AI and tech improvements to make the technology changes better. And lastly, we're helping on the people side by saying, hey, what can we do better to train our people to administratively administer these services better? So I'll give it back to Larry to talk about HR1 implementation.
Sure. I'm going to zoom back out now, but talk about a few similar things for how we're approaching the overall HR1 implementation work. Our mission, as you can see on the slide, is to minimize harm and preserve lawful benefit access as we implement this law. What that looks like, I'll get into the specifics of, but we want to make sure that we keep as many people connected to benefits as possible. We want to center the client and the customer in those interactions. We want to build solutions. Chairman, to your point, this goes to our work with Do It and the Medicaid team to make sure that we're thinking about the systems in Maryland overall and how they interact and need to change. And then really working in partnership, both with our sister agencies, with the advocate community, with providers, many of whom you'll hear from today and are probably in touch with. This is not something DHS can do alone. So some examples. I was thrilled when I joined the state of Maryland to know that they had launched the One application last summer. So this is a mobile-friendly kind of one-stop shop for multiple benefits. It is both leading edge, nationally as far as a seamless customer service interface, and makes it a lot easier to implement this law. We've also expanded our SNAP employment and training partner network. We went from 30 to 48 organizations to meet the need that we anticipate coming from all of the folks that are newly subject to work requirements. That comes with an increase in funding, but really we're trying to get at geographic diversity. We're trying to get at organizations that can match with clients, because just having a slot isn't necessarily going to work unless there's someone who wants to receive the services and needs the services being offered. We have a lot of data in Maryland that we can leverage to make sure that we are determining when work requirements should actually apply. So this goes to the fact that we're asking people to provide information about their ability to work that they've never had to apply before. We want to make sure that if they are unable to work, we are making that as easy as possible to validate through existing information, for example, with the CRIS system, to both reduce the burden on customers and staff. And we are doing the best we can to communicate and know there's so much more work that we need to do here. We have a centralized website that can be used for you if you hear from constituents, for organizations in your districts. There's also a number of FAQs on that website that are meant to be customer-centric, as well as flyers that organizations can use to reach customers. Next slide. Yeah.
Application. What are all the benefits that are included on that?
Yep.
Sure. It's got first SNAP, Medicaid, WIC. There's a couple others, including home
Well,
energy
let
assistance.
me make it simpler
Yep.
to begin with. So how many different departments are part of that?
The three big ones right now: health, human services, the health benefit exchange, and all of the programs within those large agencies.
All of theirs?
Yep. And so basically, just to give you an example, over 220,000 Marylanders have used this application. It used to take multiple trips to the office. It might have taken a couple hours. If you were on a computer, it did an autosave for a lot of these applications. Now it takes about, on average, 29 minutes to go from start to finish. And it runs you through and gets you connected to Medicaid, WIC, SNAP, et cetera.
Is it glick-free right now?
Sir, it's a lot of folks that have used it, are using it, and continue to use it. And we've been monitoring it on a daily basis to make sure that it stays as glitch-free as possible. And we're trying to roll out additional benefits and support and improvements as we move forward. Acting Secretary Rothstein of the Veterans Administration, for example, flagged, how do we help veterans better earlier in the fall? And we said, hey, how do we do that? We figured it out. It's a really simple checkbox that basically asks, are you a veteran? How do we serve you more?
And so what is it? Does that lead them to some application for veterans?
It helps you connect, your veteran status to eligible benefits, some of the work that we talked about today. And again, that's just an example of our rapid prototyping and making things work as quickly as we can.
That's great. Love that. By the way, committee, we're going to be talking more about these kinds of things, unrelated to you guys, over the coming days. In particular, I have an interest in, from the economic development standpoint and business friendliness, if we can get like SStat and the comptroller and labor all in one place. So when a business does what they need to do to run their business, they only have to go to one place instead of what is going on right now. And I know it's been complicated for those agencies in the past, and I understand that, but the fact that this has been accomplished gives me hope, and we should be doing this wherever we can.
So continuing on with some of the strategies that we're leveraging, we've talked a little bit about AI, but we received a competitive grant from the Public Benefits Innovation Fund. Maryland actually got 2 of 7 national grants, and 1 is for MDH and DHS and Do It to work on AI strategies to improve the customer experience. So the example that is going to be a centerpiece of this is all these new folks are going to need to provide income verification, which it can be incredibly difficult if you don't have a W-2. And this will provide a more seamless way for you to upload all your documents. They get inputted right into our E&E system, and they can give you real-time feedback as a customer for what you might be missing. You know, this is the type of thing where you might find, you know, proof of income. You often get that in this kind of place. It kind of allows folks to do some of that work before they talk to a service center. As I mentioned, we're also trying to use the diagnostic data that we have to automatically identify where people are eligible for exemptions. It's another partnership with our colleagues at the Maryland Healthcare Commission. We really, this education and training piece is ongoing for us. Deputy Secretary Perry Briskin over the Medicaid division at MDH and I have been doing a bit of a roadshow from the fall into this year. We are open to talk to any organizations that you think need a version of this presentation for both SNAP and Medicaid. And we have an incredible network of community-based organizations here in the state that are trusted messengers for our customers. We're also working, for example, with like the Maryland Department on Aging. How do we reach that 55 to 64-year-old cohort who's going to have to behave differently than they have in the past, recognizing the unique needs of that population? So we're working on a tailored messaging campaign with them. My last slide is just some resources that we want out in the universe and for you all to use. Our resource page, more information on employment and training supports, emergency food resources, and this kind of top-line message encouraging Marylanders to continue to update their information, check their eligibility, and apply for help at marylandbenefits.gov.
And with that, Mr. Chairman, we're happy to take questions.
Great. Senator Hedeman.
Thank you, Mr. Chairman. I have 2 questions. One is you said early on that that there are about 270,000 children on SNAP, and then you added those who are eligible for free and reduced. That's deduping. Do you get to 600,000 children?
So that's the SumBucks number of children that serve.
Right.
So that's the total. And then the 270,000 are the specific children that are receiving SNAP.
Okay, so the 600,000 is a combination of the summer program and throughout the rest of the year, the SNAP program.
That's just the summer, Senator. So the 270 is the ones that are year-round, and then the 600,000 are the ones that are receiving summer SumBucks. So it's the 3 months, $40 times 3, $120
Okay.
During the summer when school is out.
Okay, thank you. And my second question is, you know, there are so many, as we had found over the years, Marylanders who are unaware that they are eligible for certain kinds of benefits. Is that the case here with this program? Do you have any sense of that there are people who are eligible who are not availing themselves?
I think the answer to your question, Senator, is always. You know, we always want to increase our outreach. We always want to improve our communications. And one of the big items that we launched in 2024 was an eligibility screener, to your point right then. And it takes about 4 minutes. You can put in, you know, I'm pregnant with the following categories. It's anonymous. You don't have to give personal information. And then after you answer the questions, it spits out you should talk to, or you're eligible potentially for these items, please apply. We invite you to apply. And at the end of the day, if there is any doubt, we do invite any Marylander to apply, and then the computer and our staff will run that information.
All right, thank you.
Any other questions? Senator McCray.
Thank you, Mr. Chair. First, just want to say thank you for the work that you all are doing in reference to the challenges that we'll face as a state surrounding around H.R. 1. Mr. Chief of Staff, a couple years we've dealt with the Maryland Emergency Food Program and just getting the resources out the door, and especially with SNAP challenges, stuff that's compounding at this moment. Can you just tell us the shape that that's in now, especially with those partners that are trying to make sure that they're of service but having challenges with the respective agency?
Absolutely. And I think the most important part is we can always improve and we can always do better. As we've briefed your subcommittee, sir, we've had challenges. We've asked our colleagues both on the program side and on the finance side to start planning the moment the state passes the budget in April. And then we move towards how do we get all of the paper out the door in July. Once again, we are never quite perfect. I get plenty of phone calls from my colleagues at the food bank saying, hey, we need to get stuff out. And the short answer is the only thing we can do is we pick up the phone, we work, and we try to get it done as quickly as possible. Now, I will say during the shutdown, we did work in extreme partnership, and we got all of that $10 million out in about 2 weeks.
All right. I'll take mine offline. I get to see him in committee, but just know that it's been some reoccurring issues and just hoping that it's not 3 strikes.
Yes, sir. And again, we want to do everything we can to make it as seamless and quick as possible because that money needs to be out there.
Yep. Thank you again for your service.
Evidently, you're going to see him 16 times.
16 times.
Senator Roosevelt.
Thank you. Two, I hope, quick questions. One is, how similar or different are the new work requirements for Medicaid and for SNAP?
Sure. I had mentioned earlier that the complexity seems like a feature, not a bug. They are very aligned, but there are these differences in key areas that make it very hard to administer from the system side and then also the communication side. So in general, the law is written in slightly different terms. The emphasis on Medicaid is 80 hours a month instead of 20 hours a week, which it is for SNAP. I think we can kind of smooth that for our customers on the back end. That's one difference. Education does count for Medicaid, so that is good. It counts as something that would—
But not for SNAP.
Not for SNAP.
Right.
We actually have a chart that we can share with the committee that does a.
Okay, that'd be great. If you
It's
could
4
send it
pages
to
that shows where there's the similar and,
Yeah, that would be
and
great.
different.
That would be great, because that's obviously one of the
Yeah,
challenges.
we'll get back to you, sir.
That'd be great. Second question is, to what extent before the new law, but there already were work requirements, right? Before
Yes.
the new law?
Yep.
To what extent does the state systematically work with folks who are applying for SNAP benefits who don't meet the work requirements to help them get work?
I want to talk about SNAP. Okay. So that's really what the SNAP Employment and Training Program is, which is a feature of the program. So we partner with a number of organizations that we refer customers to that provide, they have slots in training programs. They will help them everything from resume assistance to job search. I think we see huge barriers for uptake in those programs. So while we feel pretty confident about our referral process, we see a lot of people not avail themselves of those services.
Why do you think that is?
I'm sorry?
Why do you think that is?
I think there's a lot of reasons, and I'm sure there's data on this that we can share, but I think that people, they have a lot going on in their lives, and they have a lot of restrictions that might make it very difficult to meet the work requirements. They might intend to and just never get around to it, or they might make a calculated decision that at a certain degree, things are so onerous that it's not going to be, the juice is not worth the squeeze. That's on us to smooth that as much as possible and to do everything we can within the law. But it does feel like the work requirements are quite onerous for people who are in the program.
And Mr. Vice Chair, I would also note that prior to this year, we had 30 employment and training partners across the state. We were very, very surprised when we put in a really strong package to the federal government, and they approved 48 for this coming year, this coming cycle. With employment and training, it's an interesting partnership. The federal government puts up 50%, and then the private or other organization puts in the other 50%. So there are no state funds directly linked into it. What we can do is support our partners, give them the assistance, and help promote them. For example, I'll highlight 2 major partners. That's the community colleges. The Community College of Baltimore County and the Community College in Prince George's have been stellar partners and extremely successful in their employment and training programs because of that focused, how do we serve customers, how do we grow customers, how do we develop and train them. And both of those community colleges have been really upstanding partners.
Okay, thank you. Thank you, Mr. Chairman.
If I could just add one thing that we're focused on moving forward in the work requirement space is listening to our customers about what they need that doesn't exist in their community. And that really is a local or regional question and not necessarily a state question. So we've had a webinar with our WIOA workforce partners and plan to do regional conversations and meetings to really get at some of that. To your question, what do folks need and how can we be that bridge for them?
Thank you, Mr. Chair. Thank you for all this information. We don't have, at least I don't see, some of the information that we have for our local partners, that they do help out. Baltimore County, I know they implemented for, the program that they do for the schools. And do we have any more of that information that we could get from the local partners, maybe the food banks, and they all do that, but maybe the counties, municipalities, or others, that they do their part, but do we know any of that?
Yes, and we'll get that information to you, Mr. Chairman, and to disseminate to the committee.
Thank you, Mr. Chairman.
Anyone else? Thank you. We took a lot of time on that, but I think it was very good.
Thank you.
I appreciate the presentation. Next up, we have 5 groups who are all engaged in this work, and you can all come up. And whoever wants to start first, and just roll however you'd like.
You're up first.
All right.
Are we missing one of the groups?
Are we missing one of the groups?
Yes.
Why don't you all introduce yourselves real
Sorry.
quick?
Food and Nutrition Services did not have someone who was able to come today.
Okay.
So, go first, Jason.
Great, thank you. Thank you, Mr. Chairman, Mr. Vice Chairman, and members of the committee. My name is Jason Gromley, and I'm the Senior Director of Advocacy and Government Relations for Share Our Strength, which operates the No Kid Hungry campaign across the country. And I'm really thankful for you convening this conversation about nutrition services and how we can help make sure that Marylanders are getting the resources that they need. We are a 501c3 nonprofit organization, and we are focused on ending childhood hunger across the country through that No Kid Hungry campaign, which you'll hear a little bit more about our work here in Maryland from my colleague Aisha in a few minutes. But I want to start by talking about the Supplemental Nutrition Assistance Program, or SNAP, formerly known as food stamps, because it really is the backbone of the nation's nutrition assistance safety net. SNAP helps families stretch their household budgets further by providing a grocery benefit so families can put food on the table. And this happens around the country, and it is families that you may not expect in your backyard and across the country. It provides households with about $6 per person per day. It's not a lot of money, but it really does help them make sure that parents, veterans, folks with disabilities, seniors are able to have meals on their table throughout the year. They've historically, as you heard, always been 100% federally funded, with the state splitting the administrative costs to operate the program. But through H.R. 1, or the One Big Beautiful Bill Act, which passed last July, it marked the largest cut to SNAP in the nation's history. H.R. 1 cut almost $200 billion from SNAP over the next 10 years, and it made a number of permanent changes to the program that will fundamentally change how states operate SNAP, and it's going to put millions of Americans at risk of losing access to this vital program. As a result of the bill, the nonpartisan CBO estimated that almost 2.5 million people will lose access to SNAP in an average month due to just the changes to the work requirements made in H.R. 1. Numerous other provisions will also result in reduced participation and benefit levels. CBO also projected that as a result of the provision to require states with SNAP payment error rates that are higher than 6% to pay a portion of those SNAP benefits, that, quote, some states will maintain current benefit or eligibility, others will modify benefits or eligibility, or leave the program altogether. I think it goes without saying that a state choosing to opt out of the SNAP program would have a devastating impact on the ability for parents to ensure that they and their children have enough food to eat. Regardless of the rhetoric from some in Washington, payment error rates, as you heard earlier, are not a measure of fraud and are often the result of small, unintentional errors by the applicant or by the agency that are later corrected. And even before the passage of H.R. 1, states had been doing the hard work to improve processes and training to address SNAP payment error rates. In this moment of unprecedented change and uncertainty, it's critical that any investment or changes to improve the state's payment error rate do not come at the expense of access to the SNAP program. States must balance their actions to improve the payment error rate with maintaining participation levels and ensuring that qualified individuals can access SNAP. Rather than limiting access or reducing benefits, Share Strength is working with researchers, with state partners, with nonprofits to identify and disseminate strategies that really strike that balance. And Share Strength is focused on both the long-term and the short-term challenges here. Long-term, we want to see a repeal of the harmful cuts and changes that were made to SNAP in H.R. 1. And we've endorsed the Restoring Food Security for American Families and Farmers Act of 2025, which is a mouthful, but that's Senate Bill 3281, H.R. 6088, which was introduced by Senator Ben Ray Lujan, as well as Representative Johanna Hayes. As Congress is considering a farm bill later this year, members in the U.S. House and Senate have the opportunity to undo the harmful changes that were made to SNAP, and we're going to continue pushing them with our nonprofit partners, with our government partners as well, to do just that, to make sure that we are maintaining SNAP for the vulnerable members of society. In the meantime, states are having to make difficult choices right now to implement the changes that were made in H.R. 1. And we're working in partnership with other anti-hunger community members and other organizations. NGA was mentioned, but also grocers, with the for-profit and nonprofit community, with researchers, to really push Congress to provide a delay in the implementation of the benefit cost share in H.R. 1. In the U.S. House, Representative Angie Craig introduced the Farm and Food Relief Act, H.R. 7206, which would provide a 4-year delay in the cost shift of SNAP benefits to states and a 2-year delay in the SNAP administrative cost increase, and pairing that with this economic assistance to farmers across the country. We know from our work with states across the country that it's going to take time, investment, and certainty from policymakers at both the state and the federal level to address the underlying causes of payment errors in the SNAP program. We're going to continue doing our part in D.C. to try to prevent states like Maryland from being unfairly penalized for addressing their payment error rates, while other states with the highest error rates in the country receive a temporary reprieve as allowed in H.R. 1. As we work with our partners in support of this goal, there are considerable challenges in the current political environment in D.C., but our priority at Share Strength is to work in a bipartisan manner to educate members about the impact of the programs in their state and district, and particularly how these programs are going to impact hunger for kids in their communities. So thank you for your time and attention to this matter. I'll turn it over to my colleague.
Thanks, Jason. Good afternoon, Chairman, Vice Chairman, and members of the committee. My name is Aisha Holmes, and I am the Director of No Kid Hungry Maryland. Thank you for allowing us all to join you today to discuss the concerns our neighbors are sharing related to, better? Okay, sorry about that. Thank you for allowing us to join you today to discuss the concerns our neighbors are sharing related to hunger and food insecurity. During this time, we are watching an unprecedented attack on our social safety nets. We appreciate everything that you are doing to ensure Marylanders continue to have equitable access to food, both in school and at home. Your continued support for the SNAP program, school and summer meals programs is needed now more than ever. In July, the Big Beautiful Bill was passed. Our organization polled over 1,000 Marylanders from across the state. The findings, though not surprising, were startling. Over 85% of those that we reached shared that they are experiencing stress over the cost of food, and that the cost of food is rising steadily while their incomes are not keeping up. This stress is impacting both their physical and mental health. Families are making difficult choices between food, medicine, utilities, and housing. 2/3 of those that we reached shared that one major unexpected event, such as a medical bill or a car repair, would force them to make choices at the grocery store. A dad from Anne Arundel County shared that due to a $700 truck repair, he experienced a domino effect that ultimately led to him not being able to purchase adequate food at the grocery store for 2 weeks. He was also choosing between groceries and $600 a month diabetes medicine. He's not alone. We heard this type of story over and over again. These are difficult choices being made every day. With the ongoing damage to SNAP access, these choices will only become harder. With Maryland's median income being $98,000, according to the U.S. Census Bureau, it's important to note that 7 out of 10 people we spoke to earning between $70,000 and $125,000 are among those feeling the pain. Those are middle-income families. A mom in Howard County shared that she used the last part of her emergency fund for groceries and now was limiting portions to make it stretch. In Baltimore City, a dad shared that at times his family has to skip meals, and it's mentally draining knowing that they are not eating their best. The majority of Marylanders we spoke to support SNAP, and over 90% of Marylanders want the state to find a way to address food insecurity and end childhood hunger. To this end, last summer, the state used $5.2 million in administrative match funds for summer EBT or Sunbucks. By doing so, Maryland was able to draw down over $70 million in summer benefits for children through the Sunbucks program. This successful program, only in its second year, has already served more than 600,000 students in economically struggling communities across the jurisdiction. As we look to the future, we have concerns about the ongoing impact of lower SNAP participation rates and the effect of that on community programs like Sunbucks and the community eligibility program in schools. This school year, thanks to your support, Maryland students in over 700 schools were able to access breakfast through Maryland Meals for Achievement. That is setting them up for success. We know this committee understands the importance of access for food, and we appreciate your partnership during this difficult time, making these difficult choices. Thank you again for your support. I'm going to pass to Anne from the food bank.
Oh, there we go. Thank you, Chair Gazzoni, Vice Chair Rosapep, and members of the Budget and Taxation Committee. My name is Ann Wallerstedt. I'm the Vice President of Government Relations and Strategic Initiatives at the Maryland Food Bank. I feel like I appear in front of this committee at least once or twice every session and say the same remark that food insecurity just has not meaningfully changed since the pandemic, and in some measures it's actually gotten worse. We now have data that shows that since 2019, right before the pandemic, that now food insecurity rates have risen 25%. Childhood hunger rates have risen 12%, and a lot of that is what you're probably hearing from your constituents, that food prices have actually gone up 29%. We're still seeing about 39 to 40% who are facing financial instability as a whole. 1 in 3 are still at risk of food insecurity every single year. And we actually recently just completed polling through December and January of this year, and people self-reported that 43% of them have visited a food pantry or a food bank, and 47% needed public assistance in some sort of way, financial, food assistance, healthcare, and they either were or were not able to get it. quickly, I think the perfect modern day example to illustrate the challenges that the charitable food system is facing was the shutdown. So not only did the shutdown happen, at the end of October into November, obviously we had the related SNAP pause, and that was really compounded by all the federal layoffs, which we know Maryland was really uniquely impacted from. And then, just internally, November is the busiest month for food banks with holiday meals coming out, charitable donations, and things like that. The Maryland Food Bank and then our partners with the Capital Area Food Bank, who serves Prince George's and Montgomery County, we really see ourselves as kind of the foundation of the charitable food system in Maryland. We have between us over 1,000 partners. We serve the equivalent of about 60 million meals every year. And the Maryland Food Bank alone served 1 million unique Marylanders last year. But we know that we cannot carry this alone, and the shutdown really illustrated that. So in non-emergency times, only about 15% of SNAP recipients were also accessing charitable food. And I think that really illustrates the power of the SNAP program. But in emergency times, like during the shutdown, we had a 90% increase to visits to our partner network and a 200% increase in varying outreaches to the food banks, such as calls, walk-ins, visits to our websites, Google searches for food, things like that. I'd be remiss not to mention that because of the quick actions of the administration and our friends at DHS, during that 3-week period, we were able to get out the door 2.4 million more pounds of food, 53,000 more meals on our mobile market vehicles like grocery stores on wheels, and then $2 million in cash grants, which we gave to our partners to be able to source from food outside of the Maryland Food Bank just because we were, frankly, at capacity. This was all absolutely necessary at the time, but it definitely wasn't enough to replace SNAP. I mean, we did some quick back-of-the-envelope math and found that if the food banks were to carry what SNAP does, every single month we would need $90 million to serve those same populations. So we really see that a strong safety net requires not just the charitable food system as kind of a last stop for some, but also a really adequate and well-funded SNAP program. So we really appreciate us at the Maryland Food Bank, the committee's willingness to tackle this difficult issue, and we're happy to help in any way that we can as we work on the implementation of this work. Thanks.
Good afternoon, Chairman, Vice Chair. My name is LaMonica Jones. I am the Director of Maryland Hunger Solutions. Maryland Hunger Solutions is one of 3 state initiatives of the Food Research and Action Center, which is a national nonprofit that works on ending hunger across our country. Our work at Maryland Hunger Solutions centers on doing the same thing, but focusing on hunger, poverty, and its root causes across the entire state. As many of you all know, SNAP is our first line of defense against hunger. The changes to program eligibility with SNAP that followed the federal government adoption of H.R. 1 has increased the bureaucracy and red tape that many of our families and households across the state of Maryland are experiencing when it comes to accessing SNAP. One of the few statewide SNAP outreach organizations, we hear from clients on a daily basis about the challenges they experience when it comes to doing what is very, very basic, which is securing food resources so that they can feed themselves as their family. Many of the households that we talk to express challenges and concerns when it comes to just how to complete our SNAP application, challenges with where are they going to secure their next meal, how are they going to secure their next meal. A lot of our work involves, like I said, addressing the root causes of hunger. One of the things that I often say is the rent eats first. And so our households, while they are trying to determine or complete a SNAP application and feed their families, they're also struggling to determine, how am I going to pay my rent and my mortgage? How am I going to cover the cost of childcare? How am I going to pay healthcare expenses? And these are all our basic human needs that many of us don't have to think twice about, but our families are struggling to figure out how are they going to manage all of this. One of the challenges that has come up the most for us over the past year since the implementation and the passing of HR 1 has been to our immigrant and mixed status households. Like I said, we're a statewide SNAP outreach organization, and the bulk of the calls that we have received over the last year have come from our immigrant and mixed status households. There's concern with public charge, which public charge is a rule that went into effect that determines whether or not a individual will be reliant on our government programs, and often SNAP is a part of this. Our households have reached out to us out of concern that they will be considered a public charge, which we have had to remind them that they will not be, that they will still be able to access their food resources as well as other benefit programs. There's concerns that we have from households and families with having to remove their children from school out of safety, which means that they have challenges when it comes to visiting grocery stores, when it comes to doing just very, very basic things that we all do on a daily basis. When it comes to the SNAP application process, a lot of the questions that we also receive are from our immigrant and mixed status households about humanitarian eligibility. We've received quite a few phone calls from our asylees and refugees households in terms of, am I still going to be eligible? What do the changes in HR 1 mean for my family? This also impacts their children in school. A lot of our school programs, our National School Lunch Program, our school breakfast program, they use a program called broad-based categorical eligibility. And with broad-based categorical eligibility, our schools are able to utilize the data from SNAP, TCF, TANF, as well as Medicaid to determine if the children will be eligible for free and reduced price meals. With the changes that are happening with HR 1, many of our households, our families are concerned that while they will not be eligible themselves, the parent will not be eligible for SNAP themselves, what does this mean for my child being able to access free and reduced price meals? We're thankful and we're grateful for the work that has been done with Maryland Meals for Achievement, as well as advancing community eligibility provision throughout the state. We have over 700 schools now that are participating in the community eligibility provision. But it doesn't take the concern and the fear away from many of our households and our families with what will that mean for my child when they go to school? What will that mean for schools that are having to balance budgets, that are having to deal with declining participation rates, which is what we are currently seeing right now across many of our schools in the state of Maryland. One of the additional kind of challenges that we look at as we're addressing the root causes of hunger is not just the eligibility for our SNAP clients, but what does SNAP mean to the entire economy across the state of Maryland? We know for every $1 in SNAP, it generates about $1.80 in economic activity for the state of Maryland. So what does that mean? We have almost 4,000 SNAP retailers across the entire state redeeming $1.9 billion in SNAP. That also has generated, our SNAP benefits, have also generated $1.4 billion for our entire state. As we begin to cycle through and collect data on SNAP eligibility and the potential declining participation of our SNAP clients, we're running the risk of what will that mean for our SNAP retailers, and that includes our small independent retailers, those that are receiving SNAP at their stores, as well as our WIC participants. So, our response to HR 1 involves working with all of our partners, Maryland Food Bank, No Kid Hungry, as well as DHS, to make sure that we are reducing the churn rate, which is the rate in which a client drops on and off of SNAP. It's also making sure that we are conducting adequate trainings across the entire state. We conduct quarterly SNAP trainings on 101, how to better understand SNAP, as well as specialized SNAP trainings on the ABOD process. What is an able-bodied adult without dependent? What is your eligibility? What will this mean for your work requirements and your time limits in accessing benefits? So I just want to thank you for that time and your attention to this matter, and I'm happy to answer any questions.
Thank you, Mr. Chair, and just thank each and every one of you all at this table. Most of you all, I'm familiar with the work, but more importantly, I understand the importance because I've been able to see it up close. Mr. Chair, my question is for the Maryland Food Bank, Madam Vice President Wallerstedt. If you could just speak to, how do you go about choosing the partners, and specifically, how do you bring about new partners, especially as we as the state of Maryland is partnering with the Maryland Food Bank?
Yeah, thanks for that question, Senator McCray, and we really appreciate the state's support in all of our efforts year after year. So we have an entire team within our programs team of what we call regional program directors. We have 6 of them all across the state, including 2 that serve solely Baltimore City. They are in charge of reviewing all applications. They know their areas best. It would be weird coming from me. It's much better coming from them to determine that strategy. We receive about 50 applications every month, and it takes us about 45 days to review those applications, just solely because it's on top of additional workload. And then just to say out loud, during the government shutdown, it did take us longer than 45 days because we were tied up doing good work. So part of what our regional program directors are looking at is logistical, how many partners are in the area, what their hours are, what capacity they have, both in terms of staff capacity, hour capacity, location, but also storage capacity. And we also then mirror that against the organizational needs of how we're trying to respond to hunger. For example, during COVID-19 pandemic, we expanded very quickly a lot of partnerships into what we call our Pantry on the Go program, which was like the table, drive-through, walk-through food distribution methods, either boxed or, people could kind of walk through farmers market style. And, we recognize that that was absolutely necessary at the time, but it isn't necessarily the most dignified experience. It doesn't provide the most choice for people. So very slowly, we're trying to turn some of those partners into what we call brick and mortar partners, food pantries, churches, things like that. And just to say out loud, we're constantly reviewing strategy, right? Like the shutdown could totally have changed the landscape. These SNAP changes are probably going to change the landscape for different populations and their needs. So this really is an ongoing process that we're kind of reviewing the strategy in each of our areas.
Yeah. Mr. Chair, just more of a follow-up, and this is more of a comment. So we all know, especially in 2026, that systems, infrastructures that have been set up kind of leave folks that may not always have access to their own government or partners with their government. So I applaud you because you've always been responsive to me, but like figuring out how we can crack the code for folks that may not always be at that table is very important when their tax dollars are at the table, and just being able to communicate to them when does the application open back up? Hey, you may not have been successful, but here's how organizations are successful. These are folks that may have connections that are on the ground, but at the end of the day, they may not just understand the system and the infrastructure that historical partners have an edge at. So thank you again, once again, for your leadership. Thank you for communicating and being very communicative, but more importantly, just hopefully going forward in the future, those organizations that are trying to understand the system, that we can be a little bit more thoughtful.
Of course.
Thank you, Mr. Chair. And thank you all for all that you do. I don't know what we do without SNAP for so many people. One of the things that I've been thinking about, and I've brought it up a couple of times, and I don't actually know the answer, but when I'm visiting schools, especially elementary schools, at lunchtime, the amount of food that gets thrown away is just beyond belief. And I know that we want to give them nutritious food, and I've argued with the people in Montgomery County over this for years. Yes, we want them to have nutritious food, but if it all goes in the trash can, it's not getting to them anyway. And I just wondered, do you have conversations like that to find things that kids will eat? I just think it's sad when we have people that are going without food to see how much ends up in the trash can. It just doesn't add up for me.
I agree with you. Kind of across the board on that one. It is sad. I will say that specifically to Montgomery County, I do know that the new food and nutrition director there, who's been there, I think 2 years, maybe. She has really started a program where she does taste testing, like kind of, like kids walk through and they test this and then they rate it and decide whether or not it goes on to the menu for the schools. And that's been really successful. I mean, I think that I've seen that happen also in Baltimore County. And more food and nutrition directors are kind of learning how to do those types of things and to really get the feedback from their students and put the things on the menu that they'll enjoy and want to eat, and hopefully will end up reducing waste.
Thank you.
Mr. Chair, I wonder if you can talk a little bit about how you're anticipating the changes that are coming and the people who are going to be in more dire straits as a result of HR 1 within your networks to be able to get out ahead of what the fallout is likely to be.
So one of the things that we have started, so we've been an organization, we've been around since 2007. One of the things, because we are one of the few anti-hunger organizations, we do not touch any food. So we don't actually distribute food. But what we have been able to do is to lean on our SNAP expertise. So we have a SNAP team, and their work has been going out into the community, conducting outreach events at the county level as well as at the city level with various partners, even those partners that are not food partners. So with our housing partners, on our college campuses. So we lead the Hunger Free Campus Network, which addresses campus food insecurity across the state of Maryland. And so a lot of that is our training in TA. Like I shared earlier, we have a quarterly SNAP training, which is a SNAP 101 and a SNAP 102. And with both of those trainings, we dissect the SNAP application as well as how to utilize MD benefits. And with both of those, we will answer any questions that our community partners have. They are open to the public and they're housed on our website, but we make it available for anyone that has any questions, specifically with HR 1 at our outreach events as well as through our trainings. We have had several trainings that dissect HR 1. We are thankful to be one of the initiatives of FRAC, so we do have our national outlook and are able to have a lot of conversations with our legislators at the federal level, as well as within our SNAP team that's doing work in the national level. But to have these robust trainings that are able to break down HR 1, what does this mean? And even before HR 1, when the work requirements went back into effect at the state level in July of 2025, as well as at many of our outreach events, we have several one-pagers. So we have an able-bodied adult without dependent one-pager, as well as a SNAP one-pager. And so knowing that we have specific targeted communities that will be impacted differently, the impacts for HR 1 are different for our immigrant and mixed status households compared to our older adults, compared to our college students, which is another conversation on challenges with accessing SNAP. And so as we begin to assess what does our clientele look like with the conversations that we're having with DHS, with our other state agency partners, as well as at the grassroots level with residents, we're able to adjust and adapt to determine how is it that we can get ahead of it, and just making ourselves available to have as many conversations and answer as many questions as we can.
Very good.
Specifically to school-aged children, we're working very closely with our FNS partners throughout the state to make sure that every child who has the ability to access, in spite of maybe losing SNAP, is still going to be able to access Sunbucks. We know that that is one of those areas that as SNAP access goes down, they may or may not be able to access because of what LaMonica was talking about, which is the direct certification process, which DHS uses for SNAP. However, if that child is eligible for free and reduced meals, that child is still eligible for Sunbucks. And so what we want to do is kind of figure out a way with our FNS partners to bridge that. And there are some plans to go out with DHS to each of the school districts to have this conversation to make sure that as we get closer to summer, schools are more engaged in the process.
Great. Thank you.
Very good. Thank you all. We really appreciate you being here and talking about your advocacy. We appreciate your advocacy and the work that you do. And with that, that's going to conclude our briefing today on nutrition assistance, and we thank you very much. We're going to take we need to break anyway, right? All right, we're going to break here for a minute. If everybody could, if committee could just stay here for 1 second. But in general, what we're going to do is at 2:35, we're going to start the hearing on the bills. The order will be as it is out on the screens, except for one exception. The first bill we're going to hear is Senate Bill 48, the public school education alterations, and then we will maintain the rest of the order. Again, we'll get started on that at 2:35.